So the head of the World Health Organization has declared that the rapidly spreading monkeypox outbreak is now a global emergency. Tedros Ghebreyesus said the biggest risk was in Europe. So what can be done to bring it under control? Well, Anya Pop is here with the latest. Anya, what can you tell us?
Well, yes, that decision today to make monkeypox a global health emergency has been welcomed by people in health. They said they'll now get the attention that it needs. They did consider doing this a month ago when there were 3,000 cases of monkeypox from around 50 countries, but cases have gone up significantly since then. Today, 16,000 cases, including 5 deaths, have been reported to the committee from around 75 countries. So that warning change. Is worth saying that the vote was extremely tight. The committee was split, and so the WHO Director General had to cast the deciding vote. And as we've heard since this first emerged, the infection's mainly spread through skin-to-skin contact. You can get infected through surfaces as well. And as you mentioned, it's mainly between gay and bisexual men. That's because of the areas of the body that are thought to be more infectious. It's worth reminding people that it's not a sexually transmitted disease. Public health messaging has been very difficult on this because they've been keen to avoid a repeat of the so-called gay plague, you remember, from the AIDS epidemic. But some cases have gone undiagnosed because although monkeypox isn't a sexually transmitted disease, it does appear like some sexually transmitted diseases, syphilis and herpes, which means that cases have been missed and so obviously then can spread more easily.
So how worried should we be?
Well, the WHO director said today that the risk globally was moderate, but as you mentioned, except for in Europe, where the risk is high. So not great for people living here, of course. But he also said this.
Although I'm declaring a public health emergency of international concern, for the moment, this is an outbreak that's concentrated among men who have sex with men, especially those with multiple sexual partners. That means that this is an outbreak that can be stopped with the right strategies in the right groups.
Of course, what's different from this and the COVID, when that first happened, is there is a vaccine, although it is in short supply at the moment. They are working on getting more of that. The concerns at the moment are for those vulnerable groups, pregnant women, children. There has been at least one case of a child getting it in the UK. So that's their concern about how the disease will manifest in those groups. The virus is mystifying health officials a little bit because they don't know why it's spreading like this. Lots of investigations into why it's mutating, how it's spreading. But yes, this health warning is very much welcome today.
OK, thanks very much, Anya.